Parikh. He's going to give us two talks, two for the price of one today, handling the pressure, management of a hypertensive athlete, and also It's All Heart, approach to the active individual with coronary artery disease. He has a little bit of bipolar training, University of Florida and Florida State. We'll see where his heart lies. And after that, he went to a neutral site, Mayo, for internal medicine and cardiovascular, sometime in Rochester too, or 6 months in Rochester as well. Please welcome Dr. Parikh.
So we're going to talk a little bit about cardiac issues related to the athlete. The first talk will be handling the pressure management of the hypertensive patient. I have no disclosures. So when we talk about hypertension, we have to first define what are we talking about? What are the blood pressure targets? And in 2018, the AHA actually moved the goalposts. I still remember the old blood pressure goals of stage 1 hypertension being 140/90, stage 2 being 160, and the 2018 guidelines moved everything down a bit. So normal blood pressure is still less than 120/80. Those are the patients that you can say, hey, great, we'll see you next year. Elevated blood pressure, though, is 120/129/80. Those are the patients now that we can initiate lifestyle modification and begin our coaching early. I had a radiologist colleague of mine come to me in a panic because he had just had his family medicine visit and his blood pressure was 122/78, and he thought that would be fantastic, and he was told, oh, geez, you have elevated blood pressure. But it's true, and we can make interventions that will actually benefit that person. So hypertension now, though, is defined as stage 1 being 130/139/80/89, and stage 2 being over 140/90. Now, remember, these have to be used with 2 separate readings on 2 separate occasions to make the formal diagnosis. So this slide here is for the family medicine folks in the room. Just a show of hands. How many people here are family medicine docs? Just about everybody. Wow. Full disclosure, I do not take care of pediatric patients. A mentor of mine in internal medicine once told me there are 2 things that an internist fears. That is children and pregnant ladies. And so I have spent my entire professional life avoiding children and pregnant ladies. Surprise, surprise, my wife is now 30 weeks pregnant with our second child. My